Dear students, today our topic is acute abdomen. How to define it when somebody is severely ill and signs and symptoms mainly belong to abdomen. There are two types of acute abdomen due to medical reasons and number two due to surgical reasons. Acute abdomen requiring laparotomy, midline incision in case of number 1 rupture of organs like spleen, aorta. Number 2 generalized peritonitis. Acute abdomen not requiring laparotomy in case of colics, stones can require surgery but not laparotomy. Number 2 localized peritonitis due to appendicitis, diverticulitis, cholecystitis, obstruction of the bowel. अगर हम मेडिकल रीजंस के बारे में बात करें, एक्यूट एब्डोमेन हो सकता है मायोकार्डियल इन्फेक्शन की वजह से, पैन पॉलीआर्थराइटिस नोडोजा, एचएसपी, शिंगल्स, पोरफायरियाज, lead poisoning, acute gastroenteritis, typhoid fever, sickle cell crisis, malaria, pheochromocytoma, pneumococcal peritonitis, basal pneumonia, Bohr-Malin disease, also called devil's grip, Coxsackie, a viral infection, severe chest pain and abdominal pain, pedis dorsalis. Differentials of the acute abdomen are very important. Abdomen can be divided into 9 quadrants. Number 1 epigastrium, number 2 right hypochondrium, number 3 left hypochondrium, number 4 right lumbar region, number 5 left lumbar region, number 6 umbilical region, number 7 right iliac fossa, number 8 left iliac fossa, and number 9 hypogastrium. Differential diagnosis of epigastric pain. Number 1 inferior wall myocardial infarction, number 2 gastric ulcer, number 3 Bohr-Heave syndrome, ruptured esophagus, investigation CT, treatment urgent call to thoracic surgeon. Acute pancreatitis, DD of pain in right hypochondrium, number 1 right basal pneumonia, number 2 hepatitis, number 3 liver abscess due to bacterial or amoebic infection, congestive hepatomegaly due to right heart failure, cardiac tamponade, Budd-Chiari syndrome, cholelithiasis, stone of the gallbladder, acute cholecystitis, infection of the gallbladder, chronic cholecystitis, inflammation of the gallbladder, choledocholithiasis, stone in CBD, common bile duct, acute cholangitis, acute inflammation of the CBD, common bile duct, disease of pain in left hypochondrium, number 1 left basal pneumonia, number 2 splenic infarction, number 3 splenic rupture, very common after blunt abdominal trauma. Differential diagnosis of umbilical pain. Number 1 duodenal ulcer, number 2 abdominal aortic aneurysm, number 3 intestinal obstruction, number 4 mesenteric infarction, number 5 early acute appendicitis. DD of pain in right and left lumbar region. Number 1 renal colic, number 2 acute pyelonephritis due to UTI, number 3 perinephric abscess, number 4 renal infarction. Degrees of pain in right iliac fossa. Top differential upon gender. If female, ectopic pregnancy. If male, acute appendicitis. Number 2, ureteric colic, TB of the intestine, Crohn's disease, Schwartz abscess, carcinoma of the cecum, perforation of the cecum, salpingitis oophorytis due to pelvic inflammatory disease, tubo-ovarian abscess, strangulated or obstructed hernia. If a child less than 2 years can have Meckel's diverticulum, remember by 2. Age less than 2 years, prevalence 2%, size 2 inches, height 2 feet from iliocecal junction, presents as repeated right iliac fossa pain and perrectal bleed. Complication can become inflamed and cause Meckel's diverticulitis. Mimics appendicitis. Finger-like projection of the GI mucosa contains gastric and pancreatic tissue. Investigation: radionuclide scan. Treatment for inflammation: diverticulectomy. Differential diagnosis of left iliac fossa pain. Top differential: age more than 50 years, diverticulitis, except appendicitis, acute appendicitis and Meckel's diverticulum. Remaining all are same as degrees of pain in right iliac fossa. Like salpingitis oophorytis, tubo-ovarian abscess, ureteric colic, obstruction of the hernia, Schwartz abscess. Degrees of pain in hypogastrium. Number 1, cystitis due to bladder stone. Number 2, pelvic inflammatory disease. Number 3, pelvic abscess. These are the differential diagnosis of the acute abdomen in the 9 quadrants. Very important for exam point of view. आपको कोई भी सवाल acute abdomen के बारे में आए तो उस सवाल को हल करने के लिए आपको ये डिफरेंशियल हमेशा याद होने चाहिए।